quarter of 2023 compared to 2.54% recorded in the third quarter of the same year. That's coming from the Minister of Information and National Orientation, Mohammed Idris, at the ministerial briefing alongside the Coordinating Minister of Health and Social Welfare. Health correspondent Kemi Balogun has more.
This is the third edition in a series of briefings that has so far provided the platform for ministries, departments and agencies to roll out the strides achieved under the present administration. The floor is open for the Coordinating Minister of Health and Social Welfare, Mohammed Idris, to talk about the benefits of the reforms that are being spearheaded by President Tinubu. The Minister of Information and National Orientation begins by highlighting some major achievements made between the past year and now.
Has actually risen, the domestic oil production has risen from 1.22 million barrels a day in the second quarter of 2023 to about 1.55 million barrels per day in the fourth quarter of 2023. And we also know that our domestic refining capacity, according to the NBS, has also risen by about 8%.
More news and strides come from the Coordinating Minister of Health and Social Welfare, who says that in the last few months, Nigeria has recruited more than 2,000 doctors, nurses and midwives to bridge the service delivery gaps.
We've already signed almost $1 billion in terms of grant, have approval for $200 million complementary grant, and the rest of the $3 billion is in line. We are proceeding with discussions to operationalize them in the context of the sector-wide approach to improve primary health care using BHCPF as a vehicle. We are laser focused to improve the primary health care system with the interventions, preventive and curative interventions that will improve health outcomes.
The rising cost of pharmaceuticals remains a concern, and the Coordinating Minister says the short and long-term goals have been created to curb the escalating drug prices and domesticate imported drugs within the next 3 years.
To reduce the barriers for them to manufacture, to protect the industry that we have, while reducing also the cost of pharmaceuticals, which is biting alongside the cost of many other commodities and inflation that we are facing.
The minister also reveals that 750,000 more Nigerians have been enrolled in health insurance, as citizens equally await the disbursement of 50 billion naira as the first tranche of the Basic Healthcare Provision Fund. Kemi Balogun, TVC News, Abuja.